The hallway lights at Pacific Crest Medical Center hummed softly above Emma Reyes as she finished her last set of checks in the ICU. It was close to midnight, the kind of hour when the building felt suspended between waking and sleep. The monitors still beeped, the air still smelled of antiseptic and plastic and coffee, but the rush of visiting hours had faded, leaving a quieter, more focused kind of tension behind. Emma's feet throbbed inside her sneakers. She rolled one ankle then the other as she walked, feeling the dull ache rise into her calves. Her lower back complained each time she leaned over a bed to smooth a blanket or adjust a line. It was all familiar. The discomfort had settled into her body, the way the hum of the hospital had settled into her mind, constant, but no longer surprising. She moved from room to room, checking drip rates, making small adjustments, letting her hand rest for a brief moment on a forearm here, a shoulder there. Some patients slept with their mouths slightly open, faces slack in the pale light. Others dozed, stirred, and drifted again, their breaths sinking unconsciously with the soft mechanical sounds around them. In one room, an elderly man snored softly with a baseball game still frozen on the small TV screen above him. Half a dozen photos were taped to his wall, glossy prints of kids at beaches and birthday parties. Someone had brought a bouquet of bright flowers earlier that evening, still fresh, still full. Emma smiled quietly and dimmed the monitor tone a notch before stepping back into the hallway. Across from his room was another door, half open. Inside, the bed was occupied by a middle-aged woman who lay almost perfectly still, her chest rising under the thin blanket. No flowers, no photos. The visitor chair near the bed stood empty, pushed neatly into the corner, as if no one had ever bothered to pull it out. Emma stopped just outside the doorway and watched the woman's monitor for a moment. Heart rhythm steady. Oxygen good. No alarms. Nothing that demanded her attention, at least not on paper. She walked in anyway. "Hey, Ms. Carter," she said quietly, adjusting the blanket even though it did not need adjusting. "It's Emma, night shift again." The woman did not respond. She had not responded to much in the last few days, drifting in and out of a light sedation that kept her comfortable. Emma checked a line, then pretended to straighten the pillow, just so she had a reason to stay another minute. "The Padres lost," she said. "You did not miss much." Her voice felt too loud in the small room. She let the quiet settle again, then gave a final glance at the blank wall where there could have been photos. Back in the hallway, she exhaled slowly through her nose and rolled her shoulders. The ICU looped in a rough rectangle rooms, branching off from both sides. The floor was polished enough to catch faint reflections of the overhead lights. The air held a cool, filtered chill that sank into her exposed skin. Farther down, a cleaning cart squeaked when a wheel hit a crack in the tile. Somewhere, an alarm beeped twice, then stilled as another nurse silenced it. At the nurse's station, a cluster of monitors glowed in blues and greens, each small screen a set of vital signs in motion. A half-empty pot of coffee sat on a warmer, its smell sharp and burned. Emma's mug waited beside it, a faint lipstick mark drying near the rim. She sank onto a stool long enough to stretch her legs out in front of her. The vinyl seat sighed under her weight. She lifted the mug, tasted the cold coffee, and grimaced. "Still alive?" one of the day nurses asked, shrugging into a jacket as she prepared to head home. Her hair was pulled into a loose bun that had the flattened look of 12 hours under a surgical cap. "Define alive," Emma said. The other nurse chuckled, reached over to tap the screen that showed the unit's census, and winced at the number. "You get a break yet?" "Planning one," Emma answered. "Big plans. Chair? Silence. Maybe a granola bar if I am feeling wild." "You and your wild nights." The day nurse waved a tired goodbye and left her footsteps echoing briefly before the door to the staff elevator closed behind her. Emma set the mug down and rubbed the back of her neck, feeling a knot under her fingers. She had done this for years now, these nights that blurred together one string of shifted sunlight and fluorescent glow. She knew the rhythm well. Midnight often brought a lull. Alarms quieted, patients settled. For an hour or two, the unit could feel almost peaceful. She liked that part, the quiet, the focus. No visitors buzzing around asking questions, no doctors rushing between consults, just nurses, machines, and the steady work of watching people try to heal. Her mother had spent her last months in a room like these. Different hospital, different city, but the same sounds and smells. Back then, Emma had sat in the visitor chair until her back throbbed and her knees locked. She had memorized every tone of the monitors, every flicker of numbers on the screen, every shift in the nurses' voices. When her mother died, she could not bring herself to leave this world of soft alarms and cool blue light. Working the night shift felt like staying close to something she could not name. She leaned over the counter, scrolling through the electronic chart list to double-check her assignments. 5 patients, all stable for now. She ran through them in her head, ticking off tasks. Pain meds due at 1 labs to draw at 2 repositioning schedules. Nothing urgent at this exact moment. Her stomach tightened, reminding her she had not eaten more than a few crackers since the beginning of the shift. She fished in her pocket and found a crumpled protein bar, the wrapper warm from her body heat. It felt like the smallest luxury. She pushed away from the desk and started toward the tiny break room at the end of the corridor, savoring the idea of sitting in a dim, quiet space for 10 minutes. Maybe 15 if the universe was cold. The corridor stretched ahead, lit in segments by ceiling fixtures that hummed softly. She passed a window that looked out over the city. Through the glass, San Diego lay under a thin brush of marine layer, the distant glow of freeways and neighborhoods softened by mist. A faint smudge of orange on the horizon marked where the naval base sat, its lights clustered like a constellation by the water. Emma paused, hand on the window frame. On some nights she could see the blinking lights of helicopters as they arced toward the base, or away from its small, moving stars crossing the dark. Tonight the sky looked quiet, the cloud layer thick enough to hide whatever moved above it. Her pager buzzed against her hip. The vibration hit first, a dull knock against her bone. Then the short electronic chirp followed, sharp and insistent in the quiet hall. She glanced down at the small screen, expecting a routine lab result or a call from another floor. The message was short. Trauma incoming military. Helo ETA 10 Min Prep ICU Room 12B. Emma felt the brief, almost physical drop in her chest that came with any trauma page. Her body responded before her thoughts fully caught up. The protein bar crinkled in her hand as she slipped it back into her pocket. She turned away from the window, the city lights falling out of view, and started down the corridor toward the supply room, footsteps quickening against the polished floor. The supply room door gave a soft click as Emma pushed it open with her shoulder. The air inside felt cooler, edged with the faint, rubbery smell of gloves and plastic packaging. Metal shelves lined the walls from floor to ceiling, stacked with neatly labeled boxes and clear bins. Her hands moved on their own. Suction canisters, tubing, extra IV lines, pressure bags, central line kits, spare electrodes. She loaded a blue plastic cart, quickly, each item placed in a practiced order that would make sense in the half-second decisions of a crisis. Room 12B sat near the end of the ICU corridor, its window facing the dark sky over the city. The bed inside was stripped bare, wrapped in crisp white linens. The monitor over the head of the bed glowed faintly with a default screensaver. The ventilator stood idle beside it, its tubing coiled neatly. Emma wheeled the cart in and parked it by the wall. She snapped on a new pair of gloves. The thin latex tugged against her fingers as she checked the ventilator settings, ran a hand along the tubing, listened for any unintended hiss of air. She powered the monitor to the admission screen, ready to accept new vitals. She hung fresh bags of saline and prepared additional IV lines, taping them in loops so they would not tangle. Each small action slowed her breathing and sharpened her focus. The idea of a break of the protein bar and the quiet room receded without complaint. Overhead, the distant whir of rotor blades reached through the ceiling. It started as a faint tremor in the air, a sound she felt more than heard, then grew into a distinct thumping rhythm. The window in 12B vibrated slightly in its frame. A small red light on the wall began to blink, indicating the elevator from the rooftop helipad was in use. Emma peeled off her gloves, tossed them into the trash, and stepped into the hallway. Trauma coming up, she called to the unit clerk at the nurse's station. ICU, admit. The clerk nodded and picked up the phone to alert respiratory therapy and the on-call intensivist. Emma walked toward the central intersection, where the ICU hallway met the main elevator bank. Other staff were already converging there. A respiratory therapist in navy scrubs checked the settings on a portable ventilator. A surgical resident leaned against the wall, tapping the end of his pen against his thigh. The charge nurse, a compact woman named Ruth, scanned a printed trauma sheet. Ruth looked up as Emma approached. "Room 12B is ready," Emma said. "Good. He is coming straight from the ED." They stabilized enough to move him up. Ruth glanced down at the paper again. Male, early 20s, training accident at the base. Possible traumatic brain injury, rib fractures, suspected internal bleed. They are rushing him to the OR as soon as the surgeon clears. "Name yet?" Emma asked. Ruth squinted at the page. "Park Noah J. Navy. That is all they sent for now." The elevator dinged. The doors slid open to reveal a cluster of bodies around a gurney. The scent of cold night air hit them first, along with a faint trace of fuel that clung to the transport team's jackets. The paramedic at the head of the bed called out as they wheeled forward. 23-year-old male, found unresponsive after fall during training exercise, reported loss of consciousness at scene, intubated in the field, hypotensive on arrival to the ED responsive to fluids and blood. CT suggests subdural bleed. Abdomen firm suspected intra-abdominal bleed. Chest X-ray shows multiple rib fractures. Emma fell in on the right side of the gurney as they turned toward 12B. The patient's face came into focus under the bright ICU lights. He was younger than she expected. Short black hair plastered damply to his forehead, one side matted with dried blood. There was a shallow cut along his left cheekbone, the edges stained reddish-brown. His lashes were dark against skin that had the waxy pallor of blood loss. An endotracheal tube protruded from his mouth, secured with foam tape around his lips. Clear tubing snaked from his arms and neck, dripping life back into his veins. Several monitors rode along with him on the gurney. Beeps layered over beeps, a temporary chorus of machines. His heart rate blinked at the top of a small screen, faster than normal, but steady. His blood pressure displayed numbers that were acceptable for now in the way a fragile truce was acceptable. They rolled into 12B in one smooth movement. The ED nurse counted down. 1, 2, 3. They shifted his weight together from the transport gurney to the ICU bed. The mattress hissed softly as it adjusted underneath him. Emma caught his wrist with one hand to guide the move. His skin felt cool and slightly sticky with sweat. There was a faint smell of earth and metal, something outdoors brought inside. The respiratory therapist stepped in to transfer the ventilator tubing, moving with precise, economical motions. The anesthesiologist from the trauma team stood at the head of the bed, hand on the tube, eyes fixed on the ventilator's numbers. "Tube is secure," he said. "Breath sounds present bilaterally." "Let us hook to our monitor," Emma said, already reaching for the leads. They attached the ICU cables one after another, stickers pressed to his chest, side, and shoulder. The monitor over the bed flickered, then blossomed into color. Green line for heart rhythm, yellow for respiratory rate, blue for oxygen saturation, white numbers for blood pressure. Heart rate 110, the resident said, eyes on the display. Blood pressure 98/62. SpO2 96% on current vent settings. Ruth stood at the foot of the bed, looking from the monitor to the chart tracking the information. "Neurostatus?" she asked. The anesthesiologist reached for Noah's eyelids, lifting each briefly to check pupil responses with a small penlight. Pupils equal sluggish reaction, no purposeful movement yet. He has been sedated. GCS currently not fully accessible. Emma watched his face, looking for any flicker that might suggest awareness. Nothing yet. No crease of the brow, no twitch at the corner of the mouth. Only the regular rise and fall of his chest, timed to the machine. The trauma surgeon, a tall man in a wrinkled lead apron, entered the room, pulling off his radiation badge. "We are taking him back down as soon as OR3 is ready," he announced. "Subdural needs evacuation. CT suggests active bleed in the abdomen, likely splenic or mesenteric. He is young, but he is not going to tolerate this long." He looked at Emma and Ruth. "Keep him stable for 10 more minutes. Blood products are on the way up. Consent is obtained from the military medical officer. We will get him down as soon as transport is cleared." "Got it," Ruth said. Emma adjusted the IV pump to accommodate the incoming blood units. The machine chimed as she dialed through the settings. She pressed the back of her wrist against Noah's forearm, again checking the temperature. His skin felt marginally warmer now as fluid and blood trickled in. She glanced at his face once more. Up close, he looked even younger. There was a faint shadow of stubble along his jaw, too soft to be a full beard. A small scar at his chin hinted at an old childhood accident. His lashes cast thin shadows on his cheeks. She tried for a second to imagine him laughing, talking, standing in full uniform under bright sunlight. The image refused to settle. It was hard to attach movement to a body so still. The blood arrived in a red-labeled cooler. Emma spiked the unit and hung it, watching the dark fluid slide through the tubing toward his veins. The beeping of the monitor softened as his blood pressure crept upward, numbers ticking a bit higher, a bit steadier. The surgeon watched the screen for a moment, then nodded. "All right, that buys us a little room." The OR called up a minute later to say they were ready. The transport team assembled again, swapping out some cables for portable monitors. Emma loosened the brake on the bed with her foot. "Emma, stay here and keep an eye on your others," Ruth said quietly as the team began to move. "We will call as soon as he is in the OR." Emma stepped back against the wall to let them pass. The bed moved out of the room, trailing lines and wires like the tail of a kite. The ventilator bumped over the threshold, then straightened in the hall. She followed them to the elevator, stopping just short of the doors. The group wheeled Noah inside the lights in the ceiling gleaming off the metal railings. For a brief second as the gurney shifted, his head turned slightly revealing more of his profile. The cut on his cheek caught the light. The coin of dried blood at his hairline looked almost black. The elevator doors closed, and the sound of the rotor blades faded, replaced by the softer, steadier hum of the hospital's internal machinery. Emma stood there for a moment, holding the now quiet space where the bed had been. The imprint of his cold wrist remained against her skin, a faint ghost of contact. She took a slow breath, then turned back toward the ICU, the thin wheels of her cart whispering along the polished floor as she walked. The operating room called up just after 1 in the morning. Emma was at the nurse's station updating charts when Ruth hung up the phone and looked over. "Park is out of surgery," Ruth said. "Coming back to us. They got the bleed in his brain and the abdominal bleed under control. Surgeon says the next 24 hours are critical." Emma nodded, feeling a small, quiet release move through her chest. Not relief exactly, more like a rope being loosened a notch. She cleared a space on the cart for post-op supplies and made her way back to 12B. The room felt oddly large, with no bed in it, only the monitor blinking a flat line in pale green and the ventilator standing by with its tubing draped neatly. The silence carried a faint echo of the previous rush. She checked the settings again more out of habit than necessity. Ventilator ready, suction ready, extra syringes lined up in a row on the counter. Her reflection in the window showed tired eyes and a loose strand of dark hair that had fallen from her ponytail. The transport team arrived a few minutes later, guiding the bed through the doorway with practiced ease. Noah lay where he had lain earlier, but more subdued now. His head was wrapped in a clean white dressing, a small circular patch shaved above his temple, where the surgeons had worked. New surgical bandages covered his abdomen. The monitors attached to the bed sent data to the ICU screen in quick bursts. Subdural evacuated the anesthesia provider recited as they maneuvered him into position. Splenic bleed controlled, couple of tears repaired. Estimated blood loss was significant, but he tolerated it with transfusions. "We have him on sedation and pain control. You will want to keep him intubated at least for now." "Any complications?" Ruth asked. "None so far. Neurosurgery will round again in a few hours. Vitals were stable when we left the OR." They moved him from the OR bed to the ICU mattress in another coordinated lift. The mattress adjusted, puffing softly under his weight. The ventilator connected, the monitor chirped as its inputs changed, adjusting to the new patient. Emma stepped closer as the team disconnected their portable leads. She smoothed the sheet over his chest, tucking the corner near his shoulder. His skin looked slightly less pale, a faint warmth returning along his neck. A clear dressing near his scalp caught the light where it curved over shaved skin in stitches. Dr. Patel, the intensivist on call, walked in as the OR staff finished their handoff. "All right," he said, looking at the monitor, then the chart. "Pain control infusion running. Sedation started in the OR. Let us maintain that overnight. I do not want him waking abruptly with a fresh craniotomy and abdominal repair." He stepped close to the bed, lifted one eyelid gently, and shone a penlight into Noah's eye. The pupil contracted sluggishly. "Pupils are reactive. That is good. Brain has been through a lot tonight, so no one is making any promises yet." His tone was calm, steady, factual, the kind of voice that could have been discussing weather patterns instead of swelling inside a skull. A neurologist arrived shortly after, a slim woman with sharp eyes and a tablet in one hand. "Mr. Park has a traumatic brain injury," she said to Ruth and Emma after reviewing the scans. "We relieved the pressure, but swelling can fluctuate in the next few days. He may be unconscious for a while. We will monitor for any changes. Outcome is very hard to predict this early." Emma listened, arms folded loosely against her chest. Words like may and hard to predict hung in the air. She had heard them before. She knew they could stretch into weeks of uncertainty. "We will keep his environment calm," the neurologist continued. "Low stimulation, no loud noises. Continue sedation as ordered. We will reassess in the morning after another scan." When the doctors left, the room felt smaller again. The humming machines, the hiss of the ventilator, the soft compression of the mattress were the dominant sounds. Ruth tapped a note into the chart on the computer mounted to the wall, then glanced at Emma. "He is on your side of the unit," she said, "but if you are too full, I can assign him to Kelly." Emma looked at the bed, at the white dressing on his head, at the steady mechanical rise and fall of his chest. She remembered the cold weight of his wrist in her hand outside the OR doors. The vision she had tried to conjure of him upright and laughing. The fact that no one had stood in his doorway earlier with flowers or photos or frantic questions. "I will take him," she said. "I have room." "You sure?" Ruth asked. "He is going to need close watching." "I am sure." Ruth studied her for a moment, reading something in the set of her shoulders, then nodded. "All right, he is yours." Emma moved into the familiar rhythm of post-op care. She checked the surgical sites for bleeding. She verified the IV infusion rates, tightened a slightly loose piece of tape, adjusted the ventilator tubing so it did not pull on the tube at his mouth. She recorded his vital signs, charted the information, and set reminders for neurochecks, even if the initial ones would likely show little change. The night deepened outside the windows. The marine layer settled over the city, turning the distant lights into soft halos. In the ICU, the noise thinned out. Phones rang less. Footsteps became more measured, more intentional. Emma kept visiting her other patients, tending to their needs, but she found herself circling back to 12B more often than the schedule strictly required. In one of those returns around 3 in the morning, she stood at the foot of the bed for a long moment, watching him. The ventilator breathed for him. The machine held a steady rhythm, pushing air into his lungs, pulling it out again. The monitor drew his heartbeat in green strokes, a repeating pattern marching across the screen. His face remained still, muscles relaxed by sedation. She stepped closer and rested her hand lightly on the rail. "Hey, Noah," she said, her voice quiet. "It is Emma. You made it through surgery." The words felt odd addressing someone who could not respond, but the room felt stranger if she said nothing at all. She moved around to his side, checking the lines again, mostly for something to do. "You are in the ICU at Pacific Crest," she continued. "Endotracheal tube in place, in case you are wondering why you cannot talk. You are connected to enough machines to make a sci-fi movie proud, but your numbers look pretty good right now." His eyelids did not flutter, but she did not expect them to. The neurologist had been clear about the sedation. She glanced at the whiteboard on the wall. It listed his name, the date, the attending physician. It looked too clean. She uncapped a marker and added a small note in the corner. "Night Nurse Emma." The marker squeaked softly against the surface. She turned back to the bed. "It is officially Friday," she said, "in case your brain is keeping track of time in there. When you came in, it was Thursday. Busy night." One guy down the hall would not stop complaining about the Jell-O. "You are missing some quality gourmet complaining, just so you know." Her words filled the space, lightening the sterile quiet. She did not know if they reached him at all. She had read studies suggesting that hearing could remain partially intact in unconscious patients. Families often clung to that idea. Nurses did too, sometimes. She adjusted his pillow slightly. "Outside it smells like rain, but it is just fog," she said. "San Diego's version of being dramatic. I have been working nights here for a while. The city sounds different from this side of the glass." She thought of her mother then, in another hospital on another night. Remembered the way she had talked for hours, recounting recipes and childhood stories to a woman who could barely open her eyes. The doctors had not known how much her mother heard in those final days. They had used the same phrases: hard to predict, no guarantees. Back then, no one had told Emma to stop talking, so she had kept going long after her throat turned raw. She checked the time. A neuro assessment was due. She dimmed the overhead light slightly, then leaned in. "All right, Noah, we are going to check a few things." She held his wrist gently and moved his arm, testing for any resistance. His muscles stayed compliant, no purposeful motion. She shined a penlight into each eye the way she had seen the neurologist do. The pupils constricted, a little sluggish, but reactive. She documented the findings on the tablet mounted beside the bed. When she was done, she lingered again. "You probably hate this," she said softly. "Being stuck in a bed, being dependent on strangers. I would hate it. Actually, I sort of did hate it from the visitor side." Her hand found the rail again, fingers curling loosely around the cool metal. "My mother spent a lot of time in a room like this," she said. "Different city, same beeping, same smell. I used to count the sounds, so I did not think about the rest of it. The ventilator, the IV pump, the monitor, they were like a weird orchestra. The ventilator answered with its soft whoosh. The monitor beeped steadily. Somewhere out in the hall, a medication cart rattled faintly. When she was here, Emma said, I always hated walking into a room and seeing her alone. No one in the chair, no one talking to her. So, I guess you are stuck with me as background noise for a while." She gave a small wry smile, mostly to herself. "I will try to keep the stories decent." She checked his temperature, adjusted the blanket one more time, and stepped out to see her other patients. The night moved on in increments of tasks and checks. Pain meds administered, positions shifted, lines flushed, reports updated. Each time she passed 12B, she looked in. Sometimes she went all the way in just to say something small. At 4:30, she read him the headline of a local article about a surf competition being postponed. At 5, she gave him an update on the older man with the baseball game who had woken briefly to complain about the hospital coffee. At 5:30, she described the way the sky was starting to lighten, somewhere behind the fog, even though he could not see it through the drawn blinds. By the time the first hints of morning seeped into the edges of the building, she had settled into a quiet pattern. Check vitals, chart, talk, listen to the machines. In 12B, a young man from somewhere outside the hospital walls breathed in sync with a ventilator and did not move. At the nurse's station, Emma glanced once more at his name on the census list. Park Noah J. She traced the letters with her eyes, then turned back to her work, the hum of the ICU folding around her in a familiar embrace. By Saturday evening, Noah's name had begun to feel familiar on Emma's lips. "Good evening, Noah," she said as she checked his chart, the routine words settling into the soft hum of the ICU. "You and I are getting very predictable." His vital signs had settled into a pattern that made the doctors cautiously pleased. Blood pressure stable with less support. Oxygenation good. Intracranial pressures within the limits they wanted. Sedation still on deep enough that his face stayed smooth and still. Emma ran through her tasks with practiced efficiency. Inspect the incision on his scalp. Inspect the dressing over his abdomen. Check that the ventilator tubing was secure and that none of the lines were kinked. Confirm that the pumps were delivering the correct doses. She spoke while she worked. "Your neighbor down the hall finally stopped complaining about the Jell-O," she said. "Someone snuck him a muffin. Morale has improved." The ventilator sighed in and out. The monitor kept drawing the same green pattern heartbeat after heartbeat. Outside, the unit visiting hours had ended an hour ago. The voices in the hallway had shifted from the anxious chatter of families to the lower, steadier tones of staff talking shop. The overhead lights had been dimmed a little enough to soften the edges of the morning brightness without plunging the unit into gloom. Emma left 12B and made her way back to the nurse's station. She dropped into her chair, logged into a chart, and began typing in notes, fingers moving more slowly now that the long day was catching up with her. She had just finished documenting Noah's last set of vitals when she noticed Ruth standing at the edge of the desk, arms folded in an unusual crease between her brows. "You have visitors," Ruth said. Emma blinked. "For me?" "For Park." Ruth tilted her head toward the waiting area, just beyond the unit doors. 3 Navy personnel. They are asking to see him. Emma glanced up at the clock on the wall. Visiting hours were clearly over. The sign by the door that listed the times for family visits might as well have been underlined. "They have IDs," Emma asked. "Military IDs," Ruth said. "They look legit. I told them I would check with his primary nurse before I said yes or no." Emma pushed her chair back and stood. Curiosity mixed with that quiet tug she felt whenever Noah's situation brushed up against her own memories of empty visitor chairs. From the ICU doorway, she could see into the small waiting area outside. 3 men stood there in a loose triangle. They wore dress uniforms, dark fabric, pressed crisp along clean lines. Every boot was shined. Every shirt collar sat perfectly straight. Even so, there was something about them that did not match the stiff formality of the clothes. The way they held themselves, for one thing. Their shoulders squared naturally, their weight balanced on the balls of their feet. Their eyes tracked movement in the hall without seeming to. They had the stillness of people trained to move fast. One of them, the tallest, had closely cropped dark hair and a jaw that looked like it had been carved rather than grown. Another, shorter with warm brown skin, wore his hair just long enough to curl at the edges. The third had light hair and pale eyes that flicked between the unit door and the floor, his hand flexing around his white cap. Emma stepped into the open area. The tallest man straightened a fraction. The other 2 shifted subtly as if drawn into formation without needing to think about it. "Ma'am," the tall one said. His voice was low but clear. "Senior Chief Logan Hayes. This is Petty Officer Ben Ortiz and Petty Officer Ethan Cole. We are here for Petty Officer Noah Park." He said Noah's name carefully, like it was fragile but important. Emma studied their faces. Concern sat there deep and controlled. No panic, but a coiled readiness, like they were braced for bad news and trying not to show it. "I am his night nurse," she said. "Emma Reyes." Logan nodded once in acknowledgement. "We know it is after hours," he said. "We have been trying to get off base since we heard what happened. The timing did not work in our favor." Ortiz shifted his weight gaze, moving past Emma to the ICU doors, then back. "Noah does not have family nearby," Ortiz said. "He does not really have family at all outside of the team. We were hoping we could at least let him know we are here." Emma remembered Ruth's words. He does not have anyone else. She thought of the empty visitor chair in Noah's room, thought of her mother's room once upon a time chair, occupied because Emma refused to leave it empty. Officially visiting hours are done for the night, Emma said. She saw a faint tightening in Ethan's jaw, the smallest reaction quickly smoothed away. But she added, I think he would want to know his team showed up. 3 pairs of eyes focused fully on her. If you keep your voices down and follow my lead, she said, I can bring you in for a few minutes. Relief moved through their expressions in different ways. Logan's shoulders eased by a fraction. Ortiz exhaled slowly. Ethan's fingers stopped their restless movement around the cap. Thank you, ma'am, Logan said. We appreciate it. Emma keyed in the door code. The lock buzzed and she pushed the door open. The 3 men entered in single file, then fell back into that natural triangle as they walked down the hall beside her. The faint smell of starch and outdoor air followed them into the cooler, sterile scent of the ICU. As they passed other rooms, some patients' families glanced up from chairs and phones, momentarily distracted by the sight of uniforms. A tech in light blue scrubs paused beside a cart and watched them go by with a flicker of curiosity. Has anyone else been here for him? Logan asked quietly as they walked. Not that I have seen, Emma said. No one has checked in as family. Logan's mouth thinned. He nodded once as if that confirmed something he already understood. That tracks, Ortiz murmured. You are all from his unit, Emma asked. Naval Special Warfare, Logan replied. Same platoon, same team. We spend more time together than we do anywhere else. His tone was matter of fact, but there was pride under it. They reached 12B. Emma paused with her hand on the doorframe. He is sedated, she said. He has a breathing tube and a lot of lines. The neurosurgeon wants things quiet and calm. So, if you talk to him, keep it steady. Sometimes patients can hear more than they can show. Logan nodded. We understand, ma'am. Emma stepped inside. The room hummed with familiar sounds. The 3 men followed, then stopped just inside the doorway as their eyes took in the scene. Noah lay in the bed, head slightly elevated, bandages stark against his skin. The ventilator cycled. The monitor painted his heartbeat across the screen. The IV pumps clicked softly as they advanced each dose. For a moment, no one spoke. The air in the room felt dense, filled with the weight of what they were seeing and what they were remembering. Ethan's hand tightened around his cap again. Ortiz's eyes ran over the equipment, moving from monitor to pump to ventilator, reading the numbers with a seriousness that looked familiar to Emma. She recognized it from other medics, that habit of scanning a room and assembling a silent assessment. His gaze landed on the monitor. He leaned in slightly, his lips moving as he read the numbers. Heart rate looks good, he said under his breath. Pressure is decent, oxygen is solid. Emma caught his eye. You are medical, she asked. Corpsman, he said with a small nod. Field side, mostly. He gave the room another once-over, then inclined his head in a way that felt like a quiet endorsement. You all are doing right by him, he said. Thank you, Emma replied. Logan moved closer to the head of the bed. He rested his hand lightly on the rail, careful not to jostle any of the lines. Noah, he said, voice low and steady. It is Hayes. Ortiz and Cole are here, too. He spoke as if Noah could sit up at any moment and answer. You made it hard for us to get in. Like always, Logan went on. The paperwork trail out there is something else, but we found our way. Ethan stepped closer to the foot of the bed, eyes on Noah's face. His expression held something brittle under the controlled surface. You scared the hell out of Miller, he said quietly. He does not say that, but he does not need to. We know. Emma watched from the opposite side of the bed, not intruding but present. She saw the way Logan leaned slightly forward when he talked, the way Ortiz stayed tuned to the monitors, the way Ethan aimed his gaze at Noah's face, as if willing his friend to open his eyes. What happened? Emma asked, keeping her voice gentle. They only told us it was a training accident. Logan glanced at her, considering how much to say, then answered. Live fire evaluation, he said. Something went wrong with a charge. Noah pushed Thompson and Miller out of the way before it went off, took the worst of it himself. Ortiz shifted his gaze toward Noah's bandaged side. By the time we got to him, he was down, Ortiz said. He stayed conscious long enough to ask if they were breathing. Then he checked out. His jaw flexed once. Ethan swallowed. He told us he was fine, Ethan said. He could barely stand, and he told us he was fine. Emma looked at Noah again. The cut on his cheek, the dressing on his abdomen, the bandage on his head. So, he is the reason they are not in this bed instead, she said. He has a lot of reasons for a lot of things, Logan replied. There was a rough fondness in his voice. He turned his attention back to Noah. Kid, listen, he said. The mission is still on track. The intel you helped get is already in motion. You did your part and then some. Your job now is to let these people fix what they can and let your brain rest. He spoke like a leader, but there was no command in it, just an invitation. Emma felt a small shift inside her chest. The way they spoke to Noah made the room feel different, less like a clinical space, more like a place anchored by relationships she was only just beginning to see. She cleared her throat softly. "I have been talking to him during my shifts," she said. "I know he cannot respond right now, but it felt better than leaving him with only the machines." Logan looked up at her. Some of the tightness in his face eased. "That means more than you know," he said. "He hates being alone," Ortiz added. "He grew up in foster homes. A lot of rooms, a lot of beds, not much staying. Noise never bothered him, but emptiness did." Emma thought of the visitor chair in 12B empty every night. Thought of her own choice to sit in chairs like that long after doctors said it would not change the outcome. "No one should have to lie here, with no one talking to them," she said simply. Ethan had been quiet since his last comment. Now he reached into his pocket and pulled out a small metal disc. It rested in his palm, catching the overhead light. Emma could see an eagle and trident engraved on one side. The other side bore words in neat raised letters. "No one alone." He stepped around the bed and placed the coin carefully on the bedside table in the spot where Noah would see it first when he woke up. "He carries this most days," Ethan said, "from the team. We are leaving it here so he knows we were here. So he remembers he is not on his own in this." Emma reached out and touched the edge of the coin with the tip of one finger. The metal was warm from Ethan's hand, surprisingly heavy for its size. "It is a good motto," she said. "It is how we work," Logan replied. He checked the time on the small watch strapped to his wrist, then glanced at Ruth, who had appeared in the doorway at some point to observe. "We should not push our luck," he said. "We will let him rest." One by one they stepped closer to the bed for a last word. Ortiz rested his hand briefly on Noah's shoulder fingers, pressing gently into the blanket. "Your numbers look solid, hermano," he said, voice low. "You keep doing your part in here. We will cover it out there." Ethan stood at the foot of the bed again. "See you on the other side of this park," he said. There was the faintest tremor in his voice, quickly controlled. Logan leaned down so his mouth was close to Noah's ear. "You did good," he said quietly. "You protected your team. No arguments about that when you wake up. We will handle the rest until you get back on your feet." He straightened, then turned to Emma. "Ma'am," he said, "I know this is not standard, but if anything changes with his condition, could someone call us?" Emma looked at him, standing there at the earnest steadiness in his eyes at Ortiz and Ethan watching her, with the same quiet hope. "Give me your numbers," she said. She took a scrap of paper from her pocket and handed it to him. Logan wrote down 3 phone numbers in blocky, precise handwriting, then passed the paper back. "Thank you," he said, "for taking care of him. Taking care of Noah usually means taking care of all of us." Emma nodded, the paper light in her fingers. "We will do our best," she said. They filed out of the room. Their footsteps faded down the hall until the only sounds left were the ones Emma knew by heart. She stood by the bed for a moment, the quiet settling around her. Then she picked up the coin from the table and turned it between her fingers. The engraving caught the light again. "No one alone." She felt the weight of it, the way the metal pressed into her skin, solid and certain. This was more than a keepsake. It was a promise passed from one set of hands to another. She set the coin back where Ethan had placed it, angled so Noah would see it easily. "Pretty popular for someone with an empty visitor chair," she said softly to Noah. The ventilator answered, steady and patient. Emma adjusted his blanket, checked his lines one more time, and then stepped back, leaving the coin to gleam quietly in the low ICU light. After the door closed behind the 3 men, the room felt different. It was not louder. The ventilator still moved air in and out of Noah's lungs at the same steady pace. The monitor still marked each heartbeat in green. The pumps still clicked and hummed. Nothing had changed in the sounds, but the air felt more occupied, as if the space had learned something about the person in the bed and refused to go back to not knowing. Emma picked up the coin again. It sat in the center of her palm, smooth at the edges, the engraved lines catching the overhead light in thin silver glints. She turned it over once, then again. "No one alone." Her thumb brushed that phrase. She remembered the way Ethan had said it, almost apologetic, like he was giving away something private. The way Logan had leaned in close to Noah's ear. The way Ortiz had checked the monitor and given that quiet nod of approval, a medic measuring trust, not in words, but in numbers. Emma closed her fingers around the coin, feeling its weight press into her skin, then set it back exactly where it had been. "You have a good team," she said softly to Noah, "in case you needed any proof." He did not move. Sedation kept his muscles relaxed, his face smooth. Only the faint twitch of his chest with each ventilator cycle showed there was still something inside the stillness. Emma checked his chart on the wall tablet, confirming the latest orders. Sedation level unchanged, pain management steady, neuro checks at set intervals, labs scheduled, neurosurgery to reassess in the morning. She moved through the rest of her shift, tending to other patients, answering calls, silencing alarms. Yet each time she passed 12B, she felt the pull of the room. Once near midnight, she stepped in for what was supposed to be a quick check. Vitals, lines, dressings, the things she could do half asleep. Instead, she found herself standing at the bedside again, looking at the coin and the bandage on his head, at the crease where tape held the endotracheal tube in place. Your friends filled in some blanks, she said. Live fire training, bad charge. You shoved 2 people out of the way and took the hit yourself. Her voice stayed low, more a companion to the machine sounds than an interruption. That tracks with them, she added, the way they stood in here. Like this bed bothers them more than any blast ever could. She adjusted the blanket, smoothing it over his shoulder. I told them I have been talking to you, she said. I did not tell them how much it helps me too. We can keep that part between us. She did the neuro check, shining the penlight into his eyes. The pupils reacted slow but present, no change in motor response. She documented each finding, her hands moving with practiced ease, even as her thoughts lingered on the team's visit. By the time dawn crept in behind the fog, casting a pale reflection on the ICU windows, the memory of 3 men in dress uniforms had threaded itself into the night's pattern. Emma gave report to the day nurse, mentioning the visit as part of the narrative for 12B. His team came by, she said. Special warfare. They asked good questions, left a coin for him. The day nurse, a broad-shouldered man named Jared, raised his eyebrows. Special warfare, he said. So he is one of those quiet types who end up in the news without a name. Something like that, Emma said. You getting attached? Jared asked, only half teasing. Emma shrugged lightly. He is on my assignment sheet, she said. I am doing my job. Jared gave her a look that said he had been around long enough to recognize the deflection, but he let it go. Emma clocked out, walked into the pale morning light outside the hospital, and went home to a small apartment that felt particularly silent after a night full of machines and voices. She slept hard and dreamless, then woke in the early evening with the taste of hospital coffee still faintly on her tongue. When she showered, the spray on the back of her neck reminded her of the weight of the coin in her palm. By the time she walked back into Pacific Crest for her next shift, the sky was already dark. The city lights blurred against the marine layer just as they had before. At the unit door, she glanced automatically at the whiteboard that displayed room numbers and brief notes. 12B Park, Noah J. TBI Post-OP, stable, sedated. Stable. She keyed in the code and stepped into the familiar hum of the ICU. The same smells, the same lights, the same mix of urgency and control. She dropped her bag in the staff room, clipped her badge into place, and made her way to the nurse's station to get report. Jared met her with a short stack of charts on the screen. Your guy in 12B held steady all day, he said. No major changes. Labs look decent. Pressors are off now. Off entirely, Emma asked. Pressure has been good without them for 8 hours, Jared said. Neuro signed off on continuing sedation for now. They like his numbers. They are just not ready to let him wake up into a brand new skull situation. Emma nodded, letting that sink in. He has not had any visitors since last night, she asked. Not since the 3 in uniforms, Jared said. Word got around the unit, by the way. Half the staff thinks you are in a secret action movie now. I missed the camera crew, Emma replied. Jared laughed. Check his neuro when you can, he said. Same schedule, pupils have stayed reactive, no surprises so far. Emma took the assignment sheet and headed toward the far side of the unit. Her other patients called for her attention first, each with their own needs and stories. She adjusted doses, answered questions, navigated a minor medication reaction. Finally, she reached 12B. The door was slightly ajar. The light inside was low, the monitor glow throwing soft green and blue across the room. The coin still sat on the bedside table, exactly where she had left it. She stepped in and let the door ease shut behind her. Night again, Noah, she said. You are keeping the same hours I am. Not the best club to be in. She moved to the monitor, scanning the numbers. Heart rate in the 80s, blood pressure holding at a comfortable level, oxygen saturation strong, ventilator settings unchanged. You gave the blood pressure meds a break today, she said. That is a good sign. She bent to inspect the dressings. The bandage over his scalp showed no fresh bleeding. The abdominal dressing was clean, edges dry. No sign of new swelling around the site. She checked the lines following each tube with her fingers, making sure connections were secure. Everything was in place. Only when the list in her head was complete did she let herself settle into the chair by the bed. It was the same kind of chair she had sat in beside her mother, the same uncomfortable cushion, the same slight wobble in one leg. The familiarity of it grounded her and unsettled her in equal measure. She leaned forward, forearms on her knees, hands loosely clasped. "Your team asked if someone would call them," she said. "I have their numbers in my pocket. They made it sound like anything that happens to you is happening to them too." She paused, listening to the ventilator, to the beeps. "I get that," she said. "In my family it was just my mother and me. So when something happened to her, it felt like it happened to both of us. There was not enough distance for it to be otherwise." Her gaze went to the coin. The inscription faced her. "You brought a piece of something like that in here with you," she said. She reached over and turned the coin so its edge touched his fingertips, resting just close enough that his skin brushed the metal. "Ortiz says your numbers look solid," she said. "You got a medic's seal of approval. That is worth something." She sat back and studied his face. In the dim light, the angles of his features softened. The harsh edges of the bandage and tape receded, leaving only the suggestion of the young man beneath them. "You know what I realize," she said. "You are not really a stranger anymore. I know how your heart reacts when the lab tech draws blood. I know how your blood pressure dips when the sedation runs a little heavy, and how it comes back up when we adjust. I have read more about your brain than I have ever read about anyone's brain outside of a textbook." She smiled faintly. "And I know 3 men who would probably walk through walls if they thought it would help you." She performed his neurocheck with the same careful attention as the night before. Arms lifted and lowered, pupils checked, toes pressed. Still no movement, still the same measured response to light. She recorded the findings, then stayed. "You are holding steady," she said. "Sometimes that is the work, not the dramatic leaps, just not going backward while everything heals." She fell silent for a while, letting the room breathe around her. Footsteps moved past in the hall. A cart rolled by, wheels squeaking once before being corrected. A phone rang briefly at the nurse's station, stopped, then rang again. Emma spoke again, softer now. "When you wake up," she said, "this room is going to be one long blur. I do not know how much you will remember. Maybe nothing. That is what they say anyway." She looked at the coin touching his fingers. "If you do not remember my voice," she said, "you will at least know that someone kept you company, that someone watched the numbers and did not look away." Her pager buzzed a small reminder from another room. She stood, touched the rail of the bed lightly, and gave one last glance at the monitor. "Keep doing your part," she said. "I will be back." She stepped into the hallway, letting the door ease shut behind her, and moved on to the next call, the image of the coin at Noah's fingertips staying with her, as clearly as the glow of the monitor. On Monday night, the weather finally stopped pretending. The marine layer that usually just sat over the city had thickened into real clouds during the day. By the time Emma walked across the hospital parking lot for her shift, the sky above Pacific Crest was a low gray ceiling. The first drops of rain tapped against her windshield on the drive-in. By the time she reached the staff entrance, the rain had turned into a steady sheet that hissed over the pavement and streaked the glass doors. Inside, the air felt even cooler than usual, as if the building had pulled its own kind of storm inward. The lights in the lobby gleamed on wet floor tiles. Someone had set a yellow caution sign near the entrance where people tracked in water. Emma shook the rain from her jacket and tugged her hair out of its damp ponytail. She took the elevator up to the ICU, watching the floor numbers climb. Outside the unit, she checked the whiteboard on the wall. 12B Park. Noah J. TBI post-op, ICP improved. Sedation plan possible taper. Her eyes lingered on the phrase. ICP improved. She keyed in the door code and stepped into the familiar hum. Tonight the sounds seemed slightly muffled, like the rain pressing against the outside walls had dampened everything a little. The overhead lights glowed off the polished floor. A loose rhythm of beeps and voices floated from the various rooms. At the nurse's station, Ruth was looking at a set of scans with Dr. Patel and the neurologist Dr. Shen. The images glowed on the screen, ghostly cross-sections of a human skull sliced into neat layers of light and shadow. "That is a good reduction in swelling," Dr. Shen was saying. "The midline shift has almost resolved." Dr. Patel nodded. "He has tolerated the day well. Vitals have been stable, no spikes." Ruth noticed Emma and waved her over. "Perfect timing," Ruth said. "We were just talking about your patient in 12B. Emma moved closer, eyes going to the images. She could pick out Noah's skull now without needing the labels. The dark shapes, the lighter areas, the places the surgeons had worked. It was strange what the brain could learn to recognize. "Swelling has come down more than we expected in 48 hours, Dr. Shen said. "We still have to be careful, but this is promising. We can consider beginning a slow reduction in sedation tonight and see how he responds. Slow is the important word, Dr. Patel added. No abrupt drops. His body has been through enough. Emma nodded, absorbing the information. What should I watch for if we adjust? She asked. Any changes in blood pressure, heart rate, or respiratory pattern that concern you? Dr. Shen said. Also, any purposeful movement, eye-opening, following commands, attempts at breathing over the ventilator. We are not pushing for a full wake-up in one night. We just want to see how his brain handles a lighter load. Ruth tapped the screen lightly. Orders are in, she said. Start with a small decrease and reassess regularly. The doctors moved on to the next room. Emma picked up her assignment sheet and listened to the rest of report, but part of her attention stayed fixed on the note next to Noah's name. Possible taper. She checked on her other patients first, as always. One needed pain medication, another needed help to the bedside commode, a third needed reassurance about an upcoming procedure. She moved room to room, hands, busy, voice steady. When she finally reached 12B, the rain had intensified. It drummed against the windows in a constant low roar. Occasional gusts of wind rattled the glass. The room lights were dimmed, the monitor glow painting green and blue across the walls. Noah lay in the bed in the same position as before, head slightly elevated, bandages clean and white. The coin sat where she had left it tilted, so that its edge brushed his fingers. The inscription faced his palm now. Emma stepped inside and let the door click softly shut behind her. Evening, Noah, she said. You picked a good night to stay inside. It is ugly out there. The ventilator answered with its steady rhythm. She went straight to the pump that delivered his sedation. The bag of clear fluid hung on its pole tubing running into the IV line. The display showed the current rate in glowing numbers. She checked the new order on the wall tablet one more time, making sure she had the instructions right. Then she pressed a few buttons on the pump and watched the rate drop by a small margin. First little step down, she said. Nothing dramatic. Just enough to see if your brain wants to say anything. She moved to the monitor next, scanning the numbers. Heart rate in the 70s, blood pressure holding, oxygen saturation unchanged. She waited. Sometimes bodies reacted immediately to changes. When blood pressure medicines were decreased, numbers could leap. When sedation dropped, heart rate could edge up, respiration change. Sometimes nothing obvious happened at all. Noah's numbers stayed steady. Nice, she said. You are not protesting. She checked his dressings, his lines, every small detail that had become as familiar as the pattern of her own hands. The rain tapped harder against the window. A distant rumble of thunder rolled through the building, more vibration than sound. Emma pulled the chair a little closer to the bed and sat down. For a moment, she just listened. Ventilator, monitor, rain. Your friends were right about you, she said. You are stubborn, taking your time, refusing to rush anything. She watched his face. You know, they told me more about that day, she continued, about the charge, about you shoving Thompson and Miller out of the way. She could picture it now in flashes, even though she had not been there. A training range somewhere out by the base. Dust, heat, a miscalculation, a trainee standing in the wrong place at the wrong time, Noah seeing it a half second before anyone else and moving. They said you asked if they were breathing before you passed out, she said. Not how bad you were, not what happened to you, just if they were breathing. She shifted a bit in the chair, leaning forward. For the record, she said, they are breathing, alive, protected, still out there driving people at the hospital crazy with their boots and their politeness. The words sounded lighter than she felt. Beneath them, something heavier moved, a slow recognition of what it meant to throw your body into harm like that. Her mother had called it a particular kind of courage once, the kind she did not expect from the people she loved, but was never surprised to find. Emma's gaze slipped to the coin at Noah's fingertips. The metal caught a flicker of monitor light, flashing briefly like a tiny signal. You have a motto there, she said, nodding at the coin. No one alone. That is a big thing to write on a small piece of metal. She reached out and adjusted the coin slightly, so that it rested more firmly under the curve of his fingers. His skin felt warmer tonight, less cool than on previous days. As she moved his hand, his eyelids trembled. It was the smallest flutter, a handful of lashes brushing against his cheek in a quick, almost imperceptible motion. Emma froze, her fingers still curled around the back of his hand. Her eyes went to his face, searching for any repeat of the movement. Nothing. She held her breath, listening to the way her heart sped up in her own ears. Could be nothing, she murmured, more to anchor herself than anything else. Sedation changes could produce twitching, muscle reflexes. She had seen it before. Still, she kept her voice level. Noah, she said, leaning closer, if you can hear me, I'm going to ask you to do something. She slipped her hand fully into his, her fingers wrapping around his palm, her thumb resting lightly against the base of his fingers. "If you hear me," she said, "try to squeeze my hand." She waited. The ventilator sighed. Rain struck the window in waves. Somewhere in the hallway, someone laughed briefly and then hushed themselves. For several seconds, nothing changed. His hand lay slack in hers, skin firm over muscle, no tension. Then she felt it, the faintest increase in pressure, not a full grasp, not even what she would confidently call a squeeze in her notes. More like a ghost of movement, a soft, fleeting push against her fingers. Her heart skipped against her ribs. She kept her voice calm. "That is good," she said quietly. "Very good." Her other hand reached for the call button on the wall. She pressed it and held it for a second. "ICU nurse," a voice answered over the intercom. "This is Reyes in 12B, she said. "I am seeing possible response in Mr. Park after sedation decrease. I need Dr. Patel and Dr. Shen in here, please." "Copy that." She released the button and turned her attention back to Noah. "You are doing fine," she said. "I am not going anywhere." The door opened a minute later. Dr. Patel came in first, followed closely by Dr. Shen and Ruth. Their expressions were alert, professional, already shifting into assessment mode. "What do you have?" Dr. Patel asked. "I decreased his sedation per your order," Emma said. "His vitals stayed stable. Then I saw eyelid movement. I asked him to squeeze my hand. I felt a slight response." She knew better than to oversell it. She kept her explanation as precise as she could. Dr. Shen moved to the head of the bed, reaching for Noah's face. She lifted one eyelid, shining her penlight into his eye. The pupil constricted faster than it had on previous checks. "Reaction is sharper," she said. "Sad." "Let me try," Dr. Patel said. He took Noah's hand, his larger fingers wrapping around it. "Mr. Park," he said in a clear voice, "if you can hear me squeeze my hand." Emma watched Noah's fingers. For a moment, nothing happened. Then slowly his index and middle fingers flexed, pressing into the doctor's palm. This time the movement was unmistakable. "Good," Dr. Patel said. His tone remained even, but satisfaction touched the corners of his mouth. "That feels purposeful." Dr. Shen checked his pupils again, watching the way they narrowed under the light. "This is encouraging," she said. "We will continue the slow taper of sedation and monitor his response. No big leaps, just gradual steps." She tapped notes into her tablet, entering new guidelines. Ruth stood at the foot of the bed, eyes moving from the monitor to Noah's face. "Vitals stayed solid through all of this," she said. "No spikes." "Keep an eye on them during the next decrease," Dr. Patel told Emma. "If you see any signs of distress, you call. Otherwise, repeat the same pattern in a few hours. Brief commands, gentle stimuli. See if he gives you more." "Understood," Emma said. The doctors left as efficiently as they had arrived, moving on to the next tasks waiting in other rooms. Emma remained by the bed, her hand still holding Noah's. The skin of his palm felt slightly damp now, a hint of warmth blooming there. She did not tell him that her heart was still beating faster than normal. She did not tell him how many times she had stood in rooms like this and wanted exactly this kind of response. "You heard that right," she said softly. "Two doctors impressed. That is not nothing." The rain outside the window eased a little, the steady roar dropping back to a softer patter. The lights of the city blurred behind streaks on the glass. Emma sat back down in the chair, still close enough that her arm could rest on the bed rail. She did not let go of his hand. "Let us see how much farther you feel like coming up tonight," she said quietly. "We will take it one notch at a time." The ventilator continued its rhythm. The monitor traced each heartbeat with patient precision. Somewhere inside the sedation, a part of Noah had stirred and reached back when called. Emma stayed there for another few minutes, listening to the sounds of the room, before her pager vibrated against her hip for another patient. She gave his hand a final gentle squeeze before she stood. "I will be back," she said. She stepped out into the hallway. The door closed soft and firm, leaving 12B filled with the same familiar sounds, now carrying a new, almost imperceptible note of change. By the time Emma finished answering the page from her other patient and looped back around the unit, the rain had thinned to a mist. It still traced faint lines down the window glass, but the heavy drumming had eased. The ICU felt wrapped in a softer quiet. She checked on each of her patients in turn, delivered medications, adjusted pillows, and spoke low reassurance in a handful of rooms. The work kept her moving, though a part of her awareness kept drifting toward the far corner where 12B sat. Just after 3 in the morning, when the unit had settled into that peculiar stillness that seemed to belong only to night, she stepped back into Noah's room. The monitor greeted her with familiar numbers, heart rate still in the 70s, blood pressure comfortably steady, oxygen saturation high. The ventilator hissed and sighed, tracing its steady pattern. Noah lay in the bed, head turned slightly to one side. Bandages, clean hair still flattened where it had been shaved. The coin remained nestled under his fingers, a small ridge of metal visible where his hand curved. Emma moved to the pump and checked the sedation rate. The last small decrease had gone smoothly. Orders allowed for another taper if he tolerated it. She touched the buttons with deliberate care, lowering the infusion by another notch. "All right," she said softly. "Round 2. She watched the monitor. For a long moment, nothing changed. Then his heart rate crept up by a few beats, settling in the low 80s. Blood pressure rose by a handful of points, still well within the range the doctors liked. The ventilator showed a subtle shift as his own lungs began offering the slightest effort over the machine's rhythm. "Still playing nice," she murmured. "I will take it." She checked his pupils with the penlight. The response was crisper now, pupils constricting with more speed. His eyelashes trembled again at the touch of light. She clicked the penlight off and slipped it back into her pocket. "Noah," she said, moving to the side of the bed. "It is Emma." We turned the dial down a little more. "You might feel closer to the surface." She wrapped her hand around his again, feeling the warmth there. "If you can hear me squeeze my hand." The response came faster this time. His fingers flexed with a clear, unmistakable intent, pressing into her palm with more strength than before. It was not a strong grip, but it was undeniably his. A little current of relief ran through her. "Good," she said quietly. "You are doing very well." She called Dr. Patel again, keeping her voice steady as she described the change. He arrived with less urgency than the first time, but with equal focus. Once more, he tested for a squeeze, and once more Noah responded. Dr. Shen confirmed the pupil reactions, making another round of notes. "If this continues," she said, "we can consider reducing the sedation further during the day shift. Let his brain try to organize itself with less interference." They left new instructions and moved on. Emma stayed. The hours between 3 and 5 slipped by in their usual ways. A lab tech came in to draw blood, apologizing to Noel's quiet form, careful not to jostle the lines. A respiratory therapist checked the ventilator settings and gave Emma a nod. Somewhere down the hall, a bed alarm chirped and then was silenced. At 5, Emma sat in the chair again, eyes drifting from the monitor to Noah's face. "You are getting closer," she said. "I can feel it." Her voice had grown hoarser over the course of the night. Too much coffee and too little water. Too many words spoken into dim rooms. She checked his hand one more time before she left to prepare for shift change. When she asked for a squeeze, the pressure that closed around her fingers was firmer. The small thrill that ran through her did not show on her face. She simply nodded. "That is perfect," she said. "Keep practicing. I will see you after I get some sleep." She gave report to the incoming nurse, a woman named Jamie, describing the sedation changes and the responses in careful detail. Jamie listened, her pen ticking across the paper. "Could be a good day for him," Jamie said. "We will see what the neurologist says after rounds." "It might be," Emma replied. When she walked out of Pacific Crest that morning, the sky over the parking lot was a flat, washed-out gray. The rain had blown itself out, leaving the pavement damp and dark. She drove home through streets that glistened under the early light and slept more lightly than usual, her dreams edged with the sound of monitor beeps and the feeling of a hand squeezing hers. By the time she returned for her next night shift, the sky had cleared. Stars pricked through the fading blue above the hospital. The air smelled rinsed cleaner than it had in days. She took the elevator up, shoulders tightening, with a thin thread of anticipation she tried not to name. The whiteboard outside the ICU had changed. 12B Park, Noah J. sedation reduced, intermittent eye opening. Her breath caught for a moment. She read the note again, then keyed in the code and stepped inside. At the nurse's station, Jamie finished a call and hung up. "How is 12B?" Emma asked. Jamie smiled, the tired kind of smile that still held real warmth. "He had a busy afternoon," she said. "We followed the taper orders. He started breathing over the vent more, opened his eyes a few times. Kind of restless, kind of foggy, but he is trying. Neuro is pleased so far." "Any distress?" Emma asked. "No major spikes," Jamie said. "Little bumps here and there, but he's settled. He is not fully awake. He is stuck in between. You will want to keep a close eye on him tonight." "That part I can do," Emma said. She made a quick round of her other patients first, making sure urgent needs were handled. The minutes stretched longer than she liked. Her steps quickened as she finally turned down the hall toward 12B. Noah's room light was set at mid-level enough to see clearly without glaring. The monitor showed heart rate in the 80s, blood pressure still in a comfortable range. The ventilator remained in place, but its readings told a different story now. His lungs were making their own effort, taking slight initiative with each breath. He lay with his head turned more toward the door, as if he had shifted at some point. The bandage on his head looked the same. The dressing over his abdomen was clean. The coin still rested against his fingers. As she stepped closer, his eyelashes trembled. "Hey there," she said quietly. "I hear you have been opening your eyes without me. I am a little offended." His eyelids fluttered again. This time they parted a fraction, revealing a thin strip of dark brown. The light seemed to startle him. His brow furrowed. His fingers twitched. Emma adjusted the overhead light, dimming it a little more. "Easy," she said. "You are okay. You are in the ICU. You are safe." His eyes opened a little wider, still unfocused pupils struggling to adjust. The movement was slow, as if each millimeter took effort. She stepped closer so her face was in his line of sight. "Noah," she said, clear but soft. "It is Emma, your night nurse. We have met. A lot." He blinked, lids lowering, then rising again. His gaze drifted across the ceiling toward the monitor, then back to her. There was confusion there, a hazy searching, but it was not emptiness. His lips moved a fraction around the tube. The sound that came out was little more than air. Emma leaned closer. "I know," she said. "Tube is not great if you want to talk. That will come later. For now, we will keep it simple." She checked his vitals again. Heart rate had climbed by a few beats, but not alarmingly so. Blood pressure remained solid. She reached for his hand and wrapped her fingers gently around it. "If you understand me," she said, "try to squeeze my hand again." His fingers tightened around hers with more control this time, the pressure sustained for a second before releasing. "That is a full point across the board," she said quietly. "You are doing very well." She pushed the call button and let the team know that his responsiveness had increased. Dr. Shen came in repeating her battery of tests, satisfaction clear in her small nods and clipped phrases. There was talk of gradually shifting him toward being able to breathe on his own, of trial periods off the ventilator when his brain proved ready. After they left, the room felt strangely intimate, just Emma, Noah, the machines, and the coin. Noah's eyes had closed again during the neurologist's exam, as if the intensity of the light and noise had been too much. A few minutes later, they drifted open once more, this time landing more quickly on her. "Hi," she said. "You keep doing that, and we will be best friends." His brow creased. He blinked. His look slid away and then back, like he was trying to pull the world into focus one frame at a time. She watched the slight movements of his chest and throat as he breathed with the ventilator, as his brain relearned how to coordinate everything. "You have been asleep for a while," she said. "Surgery, healing, a lot of people have been busy keeping you here." His throat moved again. A sound escaped, a rough, broken scrape that might have been a word if the tube had not been in the way. Emma shook her head gently. "Hold that thought," she said. "We will give your vocal cords something kinder than plastic to work with before we ask you to say much." The night crept on. His cycles of eye-opening became more frequent. Sometimes he would sweep the room with an unfocused gaze and then drift off again. Sometimes he would fix on her face for several seconds, trying to parse whatever he found there. Around 2 in the morning, during one of those quiet stretches when the unit felt suspended in low light and low sound, his eyes opened again and landed on her with more clarity than before. "Hey," she said, smiling without really thinking about it. "There you are." He blinked slowly, then swallowed. His hand twitched against hers as if he was trying to communicate something beyond muscle testing. She leaned closer, watching his face. His lips moved around the tube. A faint rasp of sound came out, shaped just enough that she could catch the intention. What? Her heart clenched. "Water," she asked. "You are thirsty." He blinked once. She checked the orders and the ventilator settings. He was close to a point where they could consider a trial off the tube. For now, all she could offer was some relief. "Okay," she said. "I cannot give you a full drink yet, but I can help your mouth feel less like sandpaper." She took a small sponge swab, dipped it in water, and gently ran it along the inside of his cheeks and over his tongue, being careful not to trigger a cough or gag. He closed his eyes for a second, a faint expression of relief flickering over his face. "Better?" she asked. His fingers pressed against hers, a weak approximation of a squeeze. She pulled the chair even closer and sat down, still holding his hand. "You are probably wondering what in the world happened," she said. "We will get there. For now, I am going to give you the short version. You got hurt during training. They brought you here by helicopter. The surgeons worked hard. Your brain scared everyone for a while, but it has started behaving again." He blinked, following each word as if he was carefully stacking them in his mind. "Your team has been here," she added. "Hayes, Ortiz, Cole, they came as soon as they could get off base. Sat in that spot right over there." She nodded toward the visitor chair. "They talked to you," she said. "Told you that you did your job, that the mission went forward, that you saved people." His eyes shifted a flicker of something like urgency moving beneath the fog. He forced more sound past the tube raw and thin. The guys. Emma squeezed his hand. They are alive, she said. Thompson and Miller. Your friends told me you pushed them clear. They walked into this unit on their own legs. They are okay. The tension in his brow eased. He exhaled slowly, as if a tight band had finally loosened somewhere inside his chest. Miss Ion, he whispered around the tube, the fragments barely audible. The mission was a success, she said. The intel you helped gather made a difference. Those are Hayes' exact words in case you care about the quote. For the first time since she had known him, something like a smile ghosted across his face. It was faint and crooked and gone almost as soon as it appeared, but she saw it. She sat back a little, keeping her grip on his hand. There you go, she said. You get to rest, knowing you did what you set out to do. His eyelids grew heavy. The effort of listening, of forming broken syllables, of making sense of a world that had changed while he slept, wore on him. Before his eyes closed again, he fixed his gaze on her one more time. There was a question there she could not yet translate, but she met it with steady calm. You are in a hospital, she said. You are not alone. I will be here tonight, and your team is waiting on news. One thing at a time. His lashes brushed his cheeks as he drifted under again, this time into a lighter place than before. The ventilator kept its rhythm. The monitor marked his heart's steady work. Emma sat very still in the chair at his bedside, the weight of his hand in hers and the quiet knowledge that a part of him had finally started to come back to meet them. By the middle of the week, the night started to feel different. The ICU rhythms were the same hum of air handlers, the same chorus of monitors, the same shuffle of rubber soles on polished floors. Yet every time Emma stepped into 12B, there was a subtle new kind of tension in the air, like the unit was holding its breath with her. Noah woke more often now. At first it came in short stretches, a few minutes of foggy awareness, then a slide back under. His eyes would open, wander, find her, and then close again. Each time, the focus in them grew a little stronger. The tube was still in place, taped at the corner of his mouth. When he tried to talk, frustration flickered across his face. Emma would answer with water swabs, short explanations, reassurance. On Wednesday night, she walked into 12B at the start of her shift and saw that the ventilator screen told a different story. His own breathing effort had increased. The machine was doing less of the work. The settings had been changed to allow him more room. A note on the board read, "Weaning trials tolerated, plan for extubation if continues." She checked the latest progress notes on the tablet. There were lines of neurology and pulmonology lingo, but the gist was clear. His brain and lungs were beginning to handle their own business again. He lay with his eyes closed when she stepped to the bedside. The coin rested near his hand, as always, the metal now dulled slightly by the oils from his skin. "Evening, Noah," she said. "You are making your machines nervous. They like being in charge." His eyelashes fluttered. His eyes opened, found her, and stayed. "Hi," she said. "It is me again. You are still in the same place in case you were worried we moved you." He tried to smile around the tube. It did not work very well, but the attempt curved the muscles near his eyes. Dr. Patel came in an hour later with the respiratory therapist. They went through their checklist: gas exchange, strength of spontaneous breaths, ability to protect his airway. Emma stood at the far side of the bed, one hand resting lightly on the rail, watching without interfering. "No acute distress," the therapist said, looking at the readings. "He has been doing more and more on his own." "Mr. Park," Dr. Patel said, leaning closer, "we are thinking about taking this tube out. That will make it easier for you to talk and swallow. It will also mean you have to do all the breathing yourself. We would not offer it if we did not think you were ready." Noah's eyes shifted from the doctor to Emma and back again. There was apprehension there, but also something like relief. "If you understand what I am saying, blink twice," Dr. Patel said. Noah blinked twice. "Good," the doctor said. "We will proceed." Emma prepared the suction and helped position Noah so he was more upright. Her hands moved with practiced precision, even as a small thread of worry pulled at her. Extubation was routine when it went well, and miserable when it did not. "Deep breath for me," the therapist said, voice calm. "We are going to help you through this." They deflated the cuff, unfastened the tape, and in one smooth motion pulled the tube free. Noah gagged, once coughed hard, and sucked in a rough, ragged breath on his own. His throat worked. His chest rose on its own timing. Emma watched the numbers on the monitor. Heart rate climbed, then settled. Oxygen saturation dipped a few points, then climbed back up to the high 90s. He coughed again, turned his head slightly to one side, eyes watering. Emma handed him a suction catheter to clear the extra secretions and encouraged him in a low voice. "You are doing fine," she said. "Keep breathing. In through your nose, out through your mouth. Nice and steady." The therapist listened to his lungs, nodding. "Good air movement," he said. They fitted Noah with a simple oxygen cannula under his nose. The ventilator stood silent now, its role shifted from controller to observer, ready but no longer needed. When the others left, the room seemed to expand. The air felt different without the timed sigh of the machine. Noah's breathing remained uneven, a little raspy, but it was his. He swallowed, winced, and brought a hand slowly to his throat. Emma held out a small cup with ice chips. "Here," she said. "Small ones. Let them melt before you swallow." He let one chip melt on his tongue, eyes closing briefly at the sensation. When he swallowed, his face tightened with discomfort, but it looked bearable. His voice, when it finally came, sounded like someone had dragged it over gravel. "How long?" he asked. "Since the tube," Emma said. "Maybe 10 minutes, since you came in." She glanced at the date on the board. "You have been here about a week," she said. "You came in last Thursday night. It is Wednesday now." He frowned slightly, trying to track the jump. "Felt like one long night," he rasped. Her mouth quirked. "Parts of it were longer than others," she said. "For both of us." She checked his vital signs again and made a note for the next set of charting. His numbers looked good. The slight rise in heart rate and breathing rate were appropriate, not alarming. He watched her hand as she wrote on the tablet, then shifted his gaze back to her face. "You, nurse?" he asked. "The corner of her mouth lifted. "That is what the badge says," she replied. "Emma Reyes, night shift, expert in coffee abuse and talking too much in quiet rooms." His eyes softened, a hint of amusement flickering through the exhaustion. "Emma," he repeated the word, rough but more coherent. She nodded. "Emma," she said, "and you are Noah Park, in case you needed that confirmed." He swallowed again, working past the soreness. "I remember your voice," he said slowly. "Before. Dark. Could not move." Her pulse skipped. "In here?" she asked, gesturing toward his head. He nodded, lids drooping, then lifting again. "Talk about weather," he said. "Baseball, old guy, Jell-O." A quiet laugh escaped her, startled and genuine. "You caught that, huh?" she said. "You did miss some high-quality complaining about hospital food." He stared at her eyes, clearer now, as if seeing past the edges of his fog. "Thought I was dreaming," he murmured. "Some nights you sounded close. Some nights like far down a hallway." The way he said it made something tighten in her chest. She remembered those nights, the ones where she sat in the chair and spoke until her throat hurt. The ones where she had stood in the doorway and talked to fill in the hollow around him. "It was not a dream," she said quietly. "I was here. I like to talk to people who cannot talk back. Makes me feel mysterious." He huffed a weak breath that might have been a laugh. "Helped," he said after a moment. "Did not feel alone." The phrase landed gently, a small blunt truth. She looked at the coin by his hand, at the words stamped into the metal. "No one alone." "You have a whole team that feels the same way," she said. "They are the ones who brought that in." His gaze followed hers to the coin. His fingers lifted clumsily and closed around it, the movement slow but deliberate. He held it like someone might hold a familiar stone. "They came?" he asked. "They did," she said. "Hayes, Ortiz, Cole. They visited after hours, which is a big deal around here. I could lose my nap privileges if word gets out." He smiled, that ghost of a smile again, a little more visible this time. "Ortiz checked your vitals," she said. "Said we were doing right by you. Hayes stood over there and told you the mission went forward. Cole put that coin on your table. They left their numbers. I think they plan to haunt my phone until they see you upright." Noah stared at the coin in his hand for a long moment. His thumb traced the edge where the engraving had softened from repeated handling. "Grew up moving," he said quietly. "Foster homes. People came and went. They stayed." His voice frayed on the last word, not from pain but from something older. Emma sat down in the chair and leaned forward, forearms on her knees, hands clasped loosely. She did not say anything at first. The machines filled the space with their soft commentary. "How many homes?" she asked eventually, her tone casual, not pushing. He shrugged slightly, the movement making a few readings flicker. "Lost count," he said. "Enough that I stopped, unpacking." Her throat tightened. She kept her face neutral, the way she had learned to do when patients handed her pieces of their history like fragile objects. He looked at her again. "Being here," he said. "Not knowing where I was. Could not move. Could not see. Felt like that. Like being 6 again. New house. No one. Talking." His fingers tightened around the coin. Then your voice, he added, talking like I was already part of it, not waiting to see if I would stay. She let that sit between them for a moment. I did not know all of that, she said. I just knew leaving you in a quiet room felt wrong. He studied her, something searching in his expression. Why, he asked. She glanced at the visitor chair. The image of her younger self sitting by her mother's bed flickered brief and sharp in her mind. Because I have been on the other side, she said. In that chair. Listening to machines instead of people. It is not a sound I like anyone to get used to. His gaze followed hers to the chair, then back. You could have just done your job, he said. Vitals, meds, charts. I did those too, she said. You are not special. He gave her a look that said he was not fooled. You know what I mean, he said, voice still rough, but a little stronger. You stayed, talked, checked more than you had to. She looked down at her hands, flexed her fingers once, then met his eyes again. That is what a nurse does, she said lightly. He shook his head in almost imperceptible motion on the pillow. No, he said, that is what family does. The word hung between them, simple, unadorned. Her instinct was to deflect, to make a joke, to push the moment away. Instead, she held his gaze. You have a pretty wide definition of family, she said. Team, he said. You, people who show up, stay, even when we cannot give much back. His voice thinned with exertion. A faint sheen of sweat dotted his forehead. Talking this much after extubation was work. She reached for the cup again and offered him another ice chip. We can argue about semantics later, she said. Right now, your job is to breathe and not pass out on me mid-conversation. He accepted the chip, let it melt, swallowed carefully. Bossy, he murmured. Occupational hazard, she replied. They sat like that for a while. She watched his breathing pattern, ready to call respiratory at the slightest sign of fatigue. He watched the ceiling, then the window, then her, as if reacquainting himself with the idea that the world existed beyond the buzzing in his skull. At one point, his gaze slid to the doorway. Hayes, going to storm the unit, he asked. Not if I keep him updated, she said. But I put nothing past him. He has that look. The kickin' doors look, Noah rasped. She nodded. That is the one. His eyelids grew heavy. As he drifted towards sleep again, he kept his fingers wrapped around the coin. It rested partly against his palm, partly against the sheet, the words hidden now, but no less present. Emma stayed in the chair until his breathing evened out, and his numbers settled into a calm rhythm. The ICU noise seemed softer again, everything turning down a notch as fatigue pulled him into a natural, unmedicated sleep. She stood finally, her back stiff from sitting. She pulled the blanket up a little higher on his chest and smoothed it with one hand. As she turned to go, he spoke again, voice barely above a whisper, eyes still closed. Emma. She paused. Yeah, she said. Thank you, he said. For what, she asked. He exhaled slowly. For not letting me be alone, in the dark. She swallowed once the motion tight. You are welcome, she said. She stepped out into the hallway, closing the door gently. The glow from the monitor leaked out in a thin line around the frame, a soft reminder that 12B no longer held only machines and metal, and guarded hope. There was a voice awake in there now, and a man slowly learning the world again with it. By the end of the week, Noah's room no longer felt like a place where time stood still. He sat up more, now the head of the bed raised, shoulders propped on extra pillows. The oxygen cannula under his nose delivered just a whisper of support. His voice was still rough around the edges, but it had texture again. On good stretches, it carried traces of dry humor that matched the way his eyes watched the room. On one of those nights, Emma walked in to find him awake studying the whiteboard that listed his name and the date. You learning your letters all over again? She asked. He glanced at her mouth, pulling into a small, crooked smile. Just making sure I am still me, he said. Name checks out. She moved to the foot of the bed and glanced at the board. Someone from the day shift had added a simple note in one corner. Goal walk to door with assistance. How do you feel about this ambitious life plan? She asked, tapping the board lightly. He looked at these words, then at his legs under the blanket. Door does not seem that far, he said. Brain says easy. Body says wait and see. You have already had a busy week, she said. It is allowed to argue with you. He watched her check his vitals, listened as she muttered the numbers under her breath. Most nights, he said, you sound like you are narrating a game. She raised an eyebrow. What kind of game do you think this is? She asked. Something with stats, he said. Scoreboard, up there. He nodded toward the monitor. If heart rate is good, you win a prize. Terrible prize, she said. You get to keep doing this. He smiled again, a little easier this time. She helped him sit a bit taller, straightened the lines at his arms, adjusted the blankets. When he tired, he closed his eyes and let her work without protest. "How much do you remember now?" she asked quietly when his breathing had settled again. He opened his eyes slowly. "Range," he said. "Some pieces sharp, some just noise. I remember range, heat, smell of smoke, Thompson yelling something. The rest is out of order." "Do you remember the helicopter?" she asked. He hesitated, then shook his head. "Wind," he said. "Rotors, maybe, could be, another day." "What about here?" she asked. "The first few nights?" He looked at the ceiling. "Your voice," he said. "Machines. Sometimes felt like I was deep underwater, could hear you, above it. Sometimes you sounded like you were right at my ear." His gaze moved back to her. "And I remember the coin," he added. He lifted it from the blanket where it always seemed to rest now. The metal caught the light. He turned it, thumb tracing the familiar words. "Figured out who left it," he said. "Not the quietest group on Earth," Emma said. His mouth curved. "Subtlety is not the point," he replied. Her pager buzzed. She checked the number and saw it was the nurse's station. She squeezed his shoulder lightly. "I will be back," she said. At the station, Ruth held the phone out to her, one hand covering the mouthpiece. "Call for you," Ruth said. "Wants you by name. Sounds very official." Emma took the receiver, cool plastic sitting solid against her palm. "This is Reyes," she said. A woman's voice answered, crisp and controlled, with the kind of authority that needed no introduction. "Mrs. Reyes, this is Commander Victoria Barnes," the voice said. "Naval Special Warfare Group. Am I speaking with the nurse caring for Petty Officer Noah Park?" Emma straightened a little, even though the caller could not see her. "Yes, ma'am," she said. "I am on nights with him." There was a small pause on the other end of the line, just long enough to feel deliberate. "I know you are busy," Commander Barnes said. "I will not keep you long. I wanted to thank you directly. I have received multiple reports from his team about the care he has received. Your name appears often and emphatically." Emma glanced at Ruth, who pretended to be very invested in a stack of papers. "I appreciate that, Mom," Emma said. "We have a good team here." "I am sure you do," Barnes said. "In this case, I am told you went beyond what anyone could reasonably ask. You stayed. You talked to him. You advocated for him when he could not do it for himself." Emma felt heat rise faintly in her face. She shifted the phone to her other ear. "I did what any nurse would," she said. "I have worked with many nurses," Barnes replied. There was a thread of wry respect in her voice now. "I know there are excellent ones. I also know when someone chooses to go further because they care in ways that cannot be written into a job description." Emma did not quite know how to answer that. Barnes continued. "I also wanted you to know the official side of what you have been seeing," she said. "Petty Officer Park has been recommended for commendation for his actions during the training event that injured him. He pushed 2 teammates out of the blast radius of a faulty charge at considerable risk to his own life. Those men are alive because of him." Emma closed her eyes briefly. She pictured Noah on the range dust in the air that split second of choice. "He did not tell me that," she said. "He rarely talks about himself in that way," Barnes replied. "His team does, loudly. They are not subtle, as you may have noticed." Emma's mouth tilted. "That I have noticed," she said. Barnes's tone softened a fraction. "You have been taking care of a very good man, Ms. Reyes," she said. "A quiet professional who has given a great deal. It matters that when his luck finally ran out, he landed in a place where someone treated him with the same loyalty he shows others." Emma looked through the glass toward the hall, where 12B's door sat closed. "It has been an honor," she said. "I do not doubt it," Barnes said. "Please let him know his command is proud of him. In whatever way seems right to you." "I will," Emma said. And Miss Reyes Barnes added, "If you ever need anything from our end, you have only to ask. You have made an impression here." The line clicked softly after they exchanged goodbyes. Emma set the phone down, the dial tone humming briefly, before Ruth reached over and hung it up. "Well," Ruth said, "I guess that answers the question of whether your nights in 12B were noticed." Emma let out a slow breath. "I did not do it for that," she said. "I know," Ruth said. "That is partly why they noticed." Emma did not reply. She picked up a chart, entered a quick note, then walked back down the hall. In 12B, Noah had drifted into a light doze, the coin still in his hand. His chest rose and fell with easy breaths. The monitor hummed along, rhythm steady. She stood for a moment watching him sleep, hearing the echo of the commander's words. "You have been taking care of a very good man." She pulled the chair closer and sat down. After a moment, his eyes opened hazy at the edges, but not confused. "You left," he said, voice soft. "Pager," she replied. "You are not the only star on this unit." "Should be," he said, the corner of his mouth twitching. "Do not push your luck," she said. He shifted his hand to the coin, glinting briefly. Phone call, he asked. From your command, she said. Commander Barnes. He blinked, attention sharpening. She call about my paperwork. Paperwork, he asked. In a manner of speaking, Emma said. She wanted to say they are proud of you, that you kept your people alive, that there is a commendation in the works. He stared at her, as if she had spoken in a language he had not used in a while. Commendation, he repeated, for doing my job. For doing more than your job, she said. He looked past her for a moment, as if seeing something else on the far wall. Thompson and Miller walk into that range every day because of what you did, she said. Barnes wanted you to hear that from someone. He shook his head slightly. They walked because we trained together, he said, because they would have done the same. That is how it works. She let the argument go. There were some kinds of humility that did not need correcting every time. Your people think highly of you, she said instead. They used a lot of adjectives. Brave, stubborn, huge pain in the neck. That pulled a small sound from him, almost a laugh. That last one is Hayes, he said. I am not naming names, she replied. He studied her face for a moment. What did you tell her, he asked. The commander, Emma said. That you are a terrible patient and that we cannot wait to get rid of you. His eyes narrowed for a second. You did not, he said. She smiled. I told her it was an honor, she said. Silence settled between them, not awkward, just full. A few days later, the goal on the whiteboard changed. Goal discharge planning. By then, Noah could walk short distances with a physical therapist at his side. The first time he made it to the doorway, and back sweat darkened the collar of his t-shirt, and his hands shook from the effort, he still refused to let them skip the second attempt. On his last morning in the ICU, the sun came in low and bright through the narrow window, turning the dust motes in the air into slow-moving specks of gold. Someone from transport arrived with a wheelchair because policy dictated that every patient left sitting. Noah sat on the edge of the bed, breathing a little harder than usual, dressed in soft gray pants and a navy sweatshirt that had clearly seen better days. The coin disappeared into his closed fist. Emma checked his chart one more time. Vitals are good, she said. Papers are signed, supplies are ready. You are officially someone else's responsibility in about 10 minutes. Finally, he said, place was starting to feel like home. She smoothed an invisible wrinkle on the shoulder of his sweatshirt. Not designed for long-term stays, she said. We like to send people back to their lives. He looked at her expression more serious now. And if you do not have much of a life to go back to, he asked. You do, she said. You have a team that has been pacing holes in some floor somewhere, waiting for this call. You have a command that knows your name. You have a second chance at almost everything. Something in his face eased. You have my number too, she added as casually as she could, in case you want to complain about physical therapy from a safe distance. He blinked. You gave it to them, he guessed. Hazard of letting your friends into my unit, she said. Information was exchanged. Before he could answer, a familiar set of footsteps sounded in the hall, the doorframe filled with uniforms. Logan stepped in first, followed by Ortiz and Ethan. The sight of Noah sitting upright in regular clothes stopped them for half a second. Look at that, Ortiz said. He has legs. Barely, Noah muttered. Ethan's grin was quick and bright. You look terrible, he said. It is great. Logan moved closer, taking in the lines of Noah's face, the way he sat, the way he breathed. You picked a dramatic way to get out of training, Logan said. You know there were easier options. Noah shrugged, winced, and let the motion settle. Had to keep things interesting, he said. Emma watched them fall into their pattern. The rhythm of their banter wrapped around the room, loosening its edges. Logan turned to her. Mom, he said. His eyes were clearer than the last time she had seen him less weighed down by worry. Looks like you did what you said you would. We did, she said. Ortiz gave her a nod that carried more meaning than words. He is walking out of here, Ortiz said. That is no small thing. You all helped, Emma said. Persuasive speeches in the middle of the night have been known to influence outcomes. Ethan stepped closer, fidgeting with the brim of his cap. We brought something, he said. He reached into his pocket and pulled out a folded piece of paper. It is not a coin, he said, but it is important. He handed it to her. Inside were 3 phone numbers already familiar and a short line. If you ever need something, call. No one alone. This is the upgraded version of the paper you gave me, she said. Logan's mouth lifted. It is a standing offer, he said. You took care of our brother. That does not end just because he changes rooms. She folded the paper carefully and slipped it into her pocket. Good to know, she said. Transport arrived then, ready to wheel Noah to the rehab floor. The orderly joked about how everyone had to ride in the chair no exceptions, hospital tradition. Noah settled back against the seat, one hand resting on the armrest, the other still wrapped around the coin. His eyes met Emma's. So, he said, I just say goodbye, and you disappear into the night shift mist. "We work here," she said. "We do not haunt the place." "Could have fooled me," he replied, voice soft. She stepped closer and rested her hand briefly on his shoulder. "You will see me," she said. "Hospitals are small. Lives that bump into each other like this tend to stay connected." He nodded, accepting that. "Thank you," he said again. The words sounded stronger now, firmer. "Keep breathing," she said. "Do as your therapists say. Try not to drive them insane." "No promises," he replied. Logan touched the back of the wheelchair, ready to guide it out. Ortiz and Ethan flanked them, a formation reassembled. As they rolled toward the door, Noah twisted slightly to look back at her. "Emma," he called. She lifted her chin. "Yeah. You ever need a noisy family?" he said. "You have one now." She felt the words land in a quiet place inside her. "I will keep that in mind," she said. Then they were in the hall, the chair wheels whispering along the floor. 3 uniforms and 1 recovering patient, moving away from the ICU and into whatever came next, carrying a coin and a promise that felt heavier than metal. The first time Emma saw Noah outside a hospital gown, she almost did not recognize him. It was months later on a bright afternoon when the air in San Diego tasted of salt and sunscreen instead of antiseptic. She was leaving a grocery store, hair pulled through a baseball cap, a bag of vegetables on one arm when someone called her name across the parking lot. "Emma." The sound of her name in that familiar rough voice snapped her head around. Noah stood a few rows away, leaning slightly on a cane, a plain t-shirt and jeans, replacing the layers of hospital fabric. The scar near his temple caught the light. His posture was straighter than she expected, though there was a carefulness in the way he shifted his weight. Beside him, Logan, Ortiz, and Ethan fanned out like they always did, unconsciously forming that protective triangle. They all looked different in civilian clothes, but the way they held themselves had not changed. For a moment, the scene doubled in her mind. ICU hallway overlaid on asphalt, wheelchair overlaid on concrete under his feet. "You really are walking," she said when they closed the distance. "Mostly," he replied, still negotiating terms with my balance. Ethan lifted a paper coffee cup in greeting. "Rehab is fun," he said, "if you are not the one doing it." Ortiz rolled his eyes. "Do not listen to him," he said. "He skipped leg day for 3 years." They stood there, caught in the small, strange intersection between her regular life and their world. "We were heading back to base," Logan said. "Saw someone who looked like she was about to write a care plan in the produce aisle." Emma snorted. "Occupational hazard," she said. Noah watched her with that same steady attention she remembered from the ICU, only now there was nothing foggy about it. "We have something for you," he said. He pulled a small envelope from his pocket and held it out. It was heavier than it looked when she took it. Inside, a thick card displayed looping script and clean lines. "You are invited." The rest blurred for a second, her eyes tracking the words slowly. Names, date, venue. "You are serious," she said. Very, Noah replied. "It is a wedding," Ethan said. "We thought you might guess that part." Emma looked from the card to Noah. "She said yes," he said simply, "and I want you there. You were on the short list before some of my own cousins." The card trembled slightly in her hand, just enough that she felt it. "You sure?" she asked. "You will have a lot of people to juggle that day." He met her gaze without hesitation. "You gave me the chance to have it that day," he said. "Feels wrong not to have you in the room." The ceremony was held months later, at a small venue on the edge of the bay. White chairs lined a lawn that sloped gently toward the water. String lights zigzagged overhead, waiting for the sun to drop. A light wind moved through the nearby trees, carrying the smell of salt and cut grass. Emma arrived early, fingers smoothing the fabric of a dress she had not worn in years. Her hair, free of the constant ponytail, fell around her shoulders in loose waves. She felt oddly exposed without her badge or scrubs, as if someone had taken away her armor. At the entrance, a table held a guest book and a neat sign with their names in smooth script, Noah and Jenna. A photo of the two of them stood beside it, taken on a beach at sunset. Noah had his arm around Jenna, his head tilted toward hers. Jeans instead of uniform, a grin that reached his eyes. Emma signed her name, hesitated, then added a short line beneath it. "Thank you for inviting me into this." She stepped into the gathering crowd. The place buzzed with low conversations. Children zigzagged between adults. Laughter floated over the music. There were uniforms here, but fewer than she had expected. Most of the men and women she assumed were from Noah's world wore simple suits and dresses, the clean lines hinting at military posture more than their clothes did. She spotted Logan, Ortiz, and Ethan near the back, talking to a group of older men whose eyes tracked everything. Logan noticed her first. "There she is," he said, making his way over. Emma braced for some kind of attention she was not sure she wanted. He did not make it dramatic. He simply gestured her into the circle. Emma, he said, meet the rest of the troublemakers. This is our CO, some of the team, and a bunch of people who have heard more about you than you might be comfortable with. She shook hands from left to right, names rolling over her. There were warm grips, nods of recognition, a few simple thank yous that carried more than the words held. One older woman with kind eyes and hair shot through with gray squeezed her fingers for a beat longer than necessary. My boy would not stop talking about the nurse who sat up with his friend, the woman said. When he calls, he is not usually that generous with his words. Emma smiled, the tight feeling in her chest softening. The music shifted. People moved toward the rows of white chairs as the ceremony time approached. Emma took a seat near the middle, not close enough to crowd the front, not far enough to feel like she had snuck in. The sun dropped lower, turning the bay water into a sheet of gold. When Noah walked down the makeshift aisle to take his place at the front, he did it without the cane. His gait still had a faint hesitation, but he moved with his shoulders back and his head up. The scar at his temple was visible, a pale line that caught the light. From this distance, it looked like another part of his story, rather than something that did not belong. Jenna came next, laughing at something one of her bridesmaids said. Her dress moved like water when she walked. Flowers brushed against the fabric. When she reached Noah, she took his hands, and something in his whole posture altered a softening that was visible even from where Emma sat. The words of the ceremony washed over Emma, familiar in structure but different in weight because of who stood there. Vows said in voices that had already weathered more than most. Promises made with an awareness of how quickly things could tilt. When it was done and cheers rose, the lights overhead flicked on. Small bulbs glowed against the darkening sky, echoing the monitor lights that had once been the only brightness in Noah's room. A different kind of constellation with a different kind of purpose. Later at the reception tables filled with plates and glasses, and the low murmur of stories being shared. Kids made games out of weaving between centerpieces. The bay reflected the string lights in long, soft lines. Emma stood near the edge of the dance floor, a glass of water in her hand, watching as Noah and Jenna moved through their first dance. The song was simple, quiet something with more guitar than drums. Noah's hand rested at the small of Jenna's back. Her head tipped toward his shoulder. They looked for a brief moment like they were in their own small world. Footsteps approached her from the side. She turned to find Noah's Commander Barnes in a simple dark dress instead of a uniform. Her posture was as straight as ever. Mrs. Reyes, Barnes said, "We finally meet in person." Commander Emma said, "You clean up well?" Barnes's mouth ticked up. "You too," she said. They watched the dancers for a moment. "Physical therapy did good work," Emma said. "He helped," Barnes replied. "He is stubborn. I assume you noticed." A little, Emma said. Barnes glanced at her. "Thank you again," she said. "Not just for the medical care. For the other parts no one writes down." Emma shrugged slightly. "It felt like the only thing to do," she said. Barnes nodded once, then moved off as someone called her name. The crowd shifted. The music changed to something quicker. People flooded the dance floor. Emma stayed on the edge, content to watch. At some point, Noah peeled away from the center of the swirl and made his way toward her. He moved more easily than he had in the parking lot months before, though she could still see the careful calculation in each step. "You avoiding the dance floor?" he asked. "Work injury," she said. "Too many 12-hour shifts. My feet have filed for retirement." He laughed. "Good to see you here," he said. "Feels right." She looked at him. The tux, the tie slightly loosened the line of the scar, the light in his eyes. "You look better than the last time I saw you sitting on the edge of a bed," she said. "Better lighting," he replied. He reached into his pocket and pulled out something small and familiar. The coin. He turned it between his fingers once, then held out his hand. "For you," he said. She stared at it. "That is yours," she said. "It was," he replied. "You earned it, or at least shared it. Ortiz, Hayes, and Cole agree." She took it carefully. The metal had warmed in his palm. The engraving was softened in places, worn smooth by years of being carried. "It is your promise," she said. "No," he said. "It is ours." He closed her fingers around the coin, folding her hand into a fist. "No one alone," he said. The words sounded different out here under lights and stars, instead of the harsh white of the ICU. They felt broader. She looked down at her closed hand, then back at him. "Careful," she said. "I might take that seriously." "I am counting on it," he replied. Someone called his name from across the lawn. He glanced over, then back at her. "I should go," he said. "Jenna collects me if I disappear too long." "Go," Emma said. "It is your party." He started to turn away, then paused. "If life throws you into the dark again," he said, "you have my number. You have ours." "We meant what we wrote." She nodded. "I know," she said. He went back to the dance floor, rejoining Jenna under the string lights. The two of them spun slowly, laughter flickering between them like another kind of glow. Emma stood on the edge, the coin warm in her palm, the words pressed into her skin. No one alone. The lights above swayed gently in the evening breeze. The bay reflected them in a long, shimmering line. Somewhere in the background, a child shouted, and a group of men in suits broke into rough, loud laughter. Emma closed her fingers more tightly around the coin and smiled the sound of their joy and the weight of the metal grounding her in the same quiet way the monitor hum had once done. The night wrapped itself around the gathering full of voices and light, and for the first time in a long time, she did not feel like she was standing apart from it. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.